Hi, my name is Alan Greenberg, and it's an honor to be part of the Community Education Group's People Worth Knowing series. My title is I'm the chair of the Department of Epidemiology at George Washington University's Milken Institute School of Public Health, and I know CEG through my role as the founding director of the District of Columbia Center for AIDS Research, or the DC CFAR. Well, I did my medical residency at St. Vincent's Hospital in New York City between 1981 and 1985, and that was just at the time the HIV epidemic was starting in major cities of the United States, New York, San Francisco, and LA. And it was obviously a very difficult time as we were taking care of many patients, largely young men for whom there was not yet antiretroviral therapy. And so we lost a lot of them, and I decided to dedicate my life to them and to, for myself, to work on HIV prevention and treatment, and I spent my career doing that. I went to the Centers for Disease Control, where I was an Epidemic Intelligence Service officer for 3 years, and I spent the next 20 years working as a Commissioned Corps officer in the Public Health Service on AIDS epidemiology in the United States and in Africa. And at the last rotation of my career, I was actually the chief of AIDS epidemiology at CDC. I retired from career number 1 in 2005 and moved to Washington, D.C. into my current roles. Obviously, this is a time of many competing important public health and national priorities, but I think keeping our focus on HIV as well is going to be important so we don't lose all the gains that we've made over the last decade. The most important thing proximally is our National HIV Ending the Epidemic initiative, in which the triad of HIV testing, rolling out and increasing the use of pre-exposure prophylaxis or PrEP, and HIV treatment and rapid initiation of HIV treatment are going to be the three major pillars of this. Three of the major pillars of this initiative. In the long run, however, what we really need is an HIV vaccine and an HIV cure, and those are the real goals of research. As a little kid, well, I wanted to be a basketball player, but it didn't take until 12 years old or so I realized I wasn't good enough and that wasn't going to happen. So I went to high school a couple years later and started an organization called High School Volunteers at the Bronx Veterans Hospital, where we provide services and care and feeding to help the doctors and nurses with, at that point, there was a lot of Vietnam veterans who were hospitalized, and that got me interested in medicine, and that's how I started my career and decided to go to medical school. Probably ice cream shakes, which, because they're cold and creamy and sweet and delicious, but I probably shouldn't eat them, so I try not to eat them, so enough about that. My hobby is probably spending time with my family as much as I can, exercise, and I like to play chess as well. Clearly, getting involved and not forgetting about the HIV pandemic is critical. And if anybody's watching this who is either an investigator or community member who's in the DC area, then clearly going to our website, signing up for our weekly update newsletter, and learning about the numerous activities and events that we have and that our community has about HIV in the city, and participating in those would be great. So I hope this was helpful, and thank you for allowing me to participate.